Welcome to this third segment on rheumatoid arthritis. Here, as you all know, in the first segment we dealt with the causes of rheumatoid arthritis and what are the symptoms regarding rheumatoid arthritis. In the second part, we looked into the possible treatment patterns available currently and also a small peek into the future possibilities. And in this part, as you all know, most rheumatoid arthritis patients, whether they know it or not, usually have other comorbidities. But once they are looking at rheumatoid arthritis, they normally don't give that much attention to the other comorbidities. And also, most rheumatoid arthritic patients develop certain complications because of rheumatoid arthritis. In both these aspects regarding comorbidities, that is having associated other disorders and diseases, as well as in the case of complications, there is a hope for what is possible when lifestyle is corrected. And so in this section, we will look into what are the comorbidities, what are the complications, and what are the lifestyle possibilities available for rheumatoid arthritic patients. And the first question to Dr. Jolie Thomson is, what are the common associated comorbidities when you look at rheumatoid arthritis?
Rheumatoid arthritis patients, usually it's very common to have other autoimmune diseases like Hashimoto's thyroiditis. And even this Graves' disease, that is hyperthyroidism, also can be, but it is comparatively low. But the Hashimoto's hypothyroidism is more common. Next is this metabolic syndrome, including this diabetes, hypertension, obesity, and dyslipidemia. That is also very common. And most of these patients will be taking so many medicines also for a long time. By the time, because of the disease and the rheumatoid arthritis and its medications, this medication, many of these medication, even steroid medications, and steroid medications can give you diabetes and hypertension. And definitely recurrent, if you are diabetic also, especially for the ladies, recurrent urinary tract infection, even the respiratory tract infection, because the immunities, you are suppressing the immunity. So another most important thing is also the chance for involvement of the even getting cancer for the ladies who's having rheumatoid arthritis and thyroiditis and levothyroxine. The chance of getting a cancer of the breast or the ovaries, right? Even for the men, it is other or the colon cancer. It is all very high. Actually, when we do investigate the patient on long-term steroids and this DMARDs and all, we do even this tumor markers test. So we have seen very common it is to see those, they are not aware of this of any cancer beginning or anything, but the tumor markers is the earliest symptom or the sign which you can see. And there are so many patients who is having this PSA for the male or the CA125 or CEA is positive. So if you are doing the lifestyle correction, especially the diabetic patients, if you are able to control the diabetes and bring down the HbA1c, this even this cancer markers can also be corrected actually. So the comorbidities can be because of the medication and also because of the disease itself, and this metabolic syndrome because of the overweight gain and so many associated problems.
Most commonly, it is said that diabetes and heart disease are the most common comorbidities of rheumatoid arthritis. Now, when we are talking about this diabetes and heart disease, actually, it is also said that treating rheumatoid arthritis along with heart disease or diabetes makes it more complex and difficult for the healthcare provider also. So, what should the patient understand and what can the patient do in this regard?
See, the problem with the doctor is actually, or the doctor and the patient both, The problem is, if there is no medicine, the pain and discomfort will come. So doctor is forced to give you medication for pain relief and so on. So if the steroid medicines, definitely the chance of getting diabetes is high, and weight gain is high. Weight gain is high, is there with the steroids and this immunosuppressant, and with the weight gain, definitely the diabetes and hypertension will come. So that is a, and even this many patients are taking even insulin in the type 2 diabetes. If you're in, actually there is already, there will be excess insulin will be there, and again for sugar controlling you injecting insulin. So actually this is actually against the, it is actually harming the body. Anything which is more than normal is a harmful thing. So this diabetic medication, not only the insulin, all the oral diabetic medications also actually, many of them work through the, by increasing the insulin level itself. So it is a hyperinsulinemia which will again create problem by increasing the weight, and your joints are already affected. You cannot bear this excess weight. So the already damaged knee and the ankle and all, they will get this osteoarthritis also. There is already rheumatoid arthritis is there, and the degenerative changes in the joint also will start, and the osteoarthritis also sets in. So the symptom treatment will be becoming more and more difficult for the doctor, and also sufferings will be more than for the patient also. So we should understand that the basic the disease is not because of the lack of medication, or the problem is your own immune system is abnormally reacting to your body, and we have to find out the reason and correct it. So you can, even the diabetes solely because you're eating more sugar or the carbohydrate. The type 2 diabetes, if you are able to control the your food habit, you don't need any medication. Only you are given, doctor is giving you medicine or insulin is only because you are not correcting your lifestyle. So we should understand that diabetes is 100% reversible disease. Type 2 diabetes, I mean. Type 1 diabetes, if the pancreas is totally gone, you cannot reverse or regrow. But even in the initial stage of, I had seen patients who is in the initial stage of type 1 diabetes, it can also be reversed provided you are willing for the lifestyle correction in a proper manner. That is all. So diabetes, comorbidities and the rheumatoid arthritis can be actually reversed in a very good extent with the, that is my experience I am telling. And if you read the medical literature, it's a lifelong disease. Type 2 diabetes is a lifelong disease. There's not much of mentioning about in the medical literature also the reversal, but reversing the diabetes now we are actually, it's coming up, the trend is coming up. But the rheumatoid arthritis, I don't think many are aware of such things, and even the literature. And I'm talking from my own experience actually. I had seen patients with diabetes, hypertension, and already one attack and one or two attacks, and or stenting and even bypass. And if the patient is willing for, you can come out of all these medications. And within most of the medications, within not with a long term, the people will think that lifestyle correction may take long time for the reversal and all. It's not a long time. Actually, within a month itself, most of the medicines will be, the patient will be come out of the most of the medication actually. And but it may take 3 to 6 months for the patient to correct their body parameters, and they learn how to manage their food and exercise and all.
Actually, in the case of rheumatoid arthritis, it is generally felt that because it is an autoimmune disease, the focus in modern medical treatment is to suppress the activity of the immune system to prevent flare-ups and inflammatory activity, etc. Now, what we also realize is that most of the complications of rheumatoid arthritis or of other comorbidities, when you look at it, is because this immune activity is not correctly performing. So, how does this immune activity suppression behave? Because most of the medications you had mentioned are focused on immune activity suppression. How does that actually affect the patient, because most of the times the complications due to these comorbidities usually develop as a result of lack of immunity of the patient. So that poor immune status of the patient ends in usually in complications getting worse. So how do you manage this situation?
See, yeah, immune system is our protector. That is basically one is from the external agents, like this bacteria and virus, everything. And also the internally, that damaged cells, that DNA damage and cancerous cells can develop inside the body. The immune system is the one who is destroying the cancer cells. And immune system, actually, it is not only the destroyer or the defense, they are the this repair part also doing. For the repair, what the body needs is nutrition. Many of the patients, the nutritional deficiencies will be there. So when the nutritional deficiency is there, the body cannot build new healthy cells. It's when the cell is damaged, if the rheumatoid arthritis, the patient is having so much damage in the joint capsule or the joint tendons, everywhere there will be damaged cells. It has to be replaced with new cells. Then only the recovery is possible. For this building healthy cells, the body needs nutrition. Actually, there is 57 nutrients are needed for the body: 14 vitamins, 14 minerals, and 20 amino acids, and four fats are there, out of which two essential fat is there. Actually, this essential fat, omega-3 and 6, is actually controlling the immune system. That is the inflammation and anti-inflammatory activities. When this anti-inflammatory activities is in imbalance because of the nutritional imbalance or excess toxin coming into the body, that is the reason for this autoimmune disease as such. And without actually, for our current mode of treatment is actually focusing on suppressing the immunity. And the body is saying, that joint is saying that I have a problem. Then you are actually making them not to say anything. You just suppressed and keep it like that. The problem with that is because the immune system is suppressed, then you can get infection and you can get cancer. The chance will be higher. And moreover, when you are taking a medicine or you are sick, if you meet with an infection or an accident and wound, then you are a complex patient. The complex patient means the treatment will be difficult. So that is why we should always come out of it. Try to most of these diseases, including the rheumatoid arthritis, is a lifestyle disease. So you have to come out of that by correcting the lifestyle. That is the only final solution. That is what I'm telling. It is not the genetics is important, definitely, but genetic we may not be able to change, but epigenetic factors can be changed, and epigenetic factors can be changed not with the medicines. The epigenetic correcting the epigenetic factors or reversing the disease progress with by correcting the epigenetic factors is through the lifestyle. So there's no harm can be there. Correcting your lifestyle will not harm you at all. If it is done in a proper way, it can be totally safe also.
See, you have mentioned that diet, then physical activity, movement, then generally the stress related to general treatments of rheumatoid arthritis. All these are very much a part of how the progress of rheumatoid arthritis takes place. So in this aspect, if you are looking at a patient who is suffering from rheumatoid arthritis, if you can put it in simple words, how should they look at their diet? How should they see physical activity? How should they see stress as how to be managed as far as they are concerned in their general outlook on rheumatoid arthritis?
Say, when we talk about the diet, first thing everyone should understand that if you are sick, you should definitely avoid food which contains color, preservatives, these food additives. You take simple food, fresh vegetables, fresh fruits, and the whole grains. Especially take more of if you are overweight, avoid this cereals such. You can take vegetables, especially leafy vegetables. The most concentrated vitamins and minerals are there in the leafy vegetables. So you take leafy vegetable and also pulses. If you are a non-vegetarian, you can take non-veg items also. But if you are overweight, you should avoid this cereals like rice, wheat, etc. And in general, this wheat, that is gluten, is very harmful for many people. So try to, if you are having rheumatoid arthritis, you see that you are avoiding this gluten containing food also. Next is actually this all these medications we are using for this immunosuppressant and also the painkillers, everything is acting on this uh, omega-6 fat mediated arachidonic acid pathway. That is, arachidonic acid is actually this inflammatory pathway. It is called inflammatory pathway. That is, inflammation is controlled by the omega-6 and anti-inflammation is by the omega-3. In our modern diet, omega-6 is very high in our food. And so that's all the nuts we are taking, this cashew nut, peanut, badam, pista, everything is having very high omega-6 level. And also the cooking oils. What you are taking, this sunflower oil and all, is very high in omega-6. Actually, all these medicines we are taking is actually, it's suppressing the inflammation. That is actually acting on the suppressing the omega-6 pathway, arachidonic acid cascade, and so many things it is called. Actually, that's not important, but see that you reduce on this nuts and this thing. Generally everyone thinks that nuts is very good, and so most of the people will be taking at least it's a habit to take some 10 this badam, and it's a habit for many. So if you're sick, these things are actually going to increase your inflammation. And what is actually healing and this suppressing the immune system, suppression of the inflammation, is actually omega-3. Omega-3 is that we are taking the sardine or the fish oil, this salmon oil, etc. contains this DHA, EPA and all. It is actually against working, it is actually parallelly working. Both this arachidonic acid and omega-6 is needed, and also the omega-3 is needed. Actually, it should be in a balance. Actually, for human body, it is actually, the balance should be actually ideally it's 1:1. But even the modern studies also shows that the omega-3/6 balance is gone very high in many people. It is actually 1:60 and all. So we can imagine what is the problem. It's not only for the this rheumatoid arthritis, it is asthma, allergy, cancer. All this will be high if the omega-6 is going high, because all these diseases comes under inflammatory disorders. So inflammation is modulated through the omega-6 fat, and if you are able to control this omega this balance in the diet, omega-3/6 balance is very important. But the problem is, it may not be possible for a patient who can think of how it is correct to this omega-3/6 balance and how to take all these 57 nutrients in the correct proportion. So that we cannot say in a simple way. So for that, you need real experts' guidance is there. I mean, it's needed for that. And you should be, one is expert guidance is needed. Next is you should be having that expert should have to provide the correct nutrition and the correct exercise, and also they should be able to guide you in the a correct manner, and how to, and also to reduce the medication with a very good understanding about your own immune system also, and which food we had to find out which food is correct for, ideal for you, and the nutritional aspect has to be corrected. All these things can be done with this our modern facilities also. We cannot just blanketly say that this is good for you and everyone it is good for. We cannot say, because each individual is different, and their interest also. Some may be vegetarian, some may be vegan, some may be interested in the non-vegetarian food. Even non-vegetarian is itself. Some may be interested in chicken, and other will be interested in fish. So many varieties we need, and people are different in so many ways. So within that diversity, we have to find out which is good for you. That is the challenge actually.
So actually in this segment, we looked at normally what comorbidities are usually seen along with rheumatoid arthritis, and generally the complications as a result of rheumatoid arthritis, and also the complications of different comorbidities when they come associated with the rheumatoid arthritis. Above all, we also understood that when treatment is focused on reducing the immune response, because we see rheumatoid arthritis as an autoimmune disorder, we generally see that the treatment is focusing on reducing the immune response. Then there is the risk of other aspects of complications increasing for the patient, because when the patient's immunity is compromised, automatically they are prone to other complications of other disorders and diseases and all that. So there needs to be a good understanding from the patient's point of view that what is the treatment doing for them. And more importantly, they have to understand that they also play a very big role by following correct methods to safeguard not only their immunity but also the ways and means to reduce the impact of rheumatoid arthritis on their lives, so that they can reduce the need for medications and also surgeries in the future. With this, we come to the end of this segment. In the next segment, we will be focusing on how clinically supervised lifestyle correction can help rheumatoid patients, and how this is necessary when the patients themselves may not be able to fully avoid lifestyle issues that help in flaring up their rheumatoid arthritis or prevent in rheumatoid arthritis being overcome in their lives. Thank you.